These children astound me, how hard they work every single day of their lives. We ask so much of them. So if I can, help them along, then I think that's the greatest thing that I can do. And then if, the research that I do and the teaching that I do today can actually help a number of families, then that's even better. I've always been really interested in this idea of equity. That's the impetus for the Partners for Change, is this idea of I'm seeing barriers for the kids that I'm testing.
It really spoke to me just to try to do something to help those folks who speak minority languages, who are not getting the care that they need, who are not accessing the services that they need because those things just don't exist for them. I have seen, kids be able to accomplish so much when they have the right group of people working with them and supporting them. And I have also seen the other side of the coin, where I see kids who really haven't made much progress at all. And it unfortunately has a lot to do with the types of services and supports that they're getting or mostly not getting. Quite often, one of the big barriers is that there's often not good interpreters available at the service centers or hospitals where they're going in for services. Interpretation is often left to family members who don't have training in how to do that. But then it even takes special skills for a clinician to know how to work appropriately with an interpreter as well. And many clinicians are not trained to do that. And so even right there, just communication can break down within just the first meeting because of a lack of interpretation and a lack of knowing how to work with interpreters. So that's even just a very simple, basic barrier that exists for a lot of people.
We need to understand those barriers, and we need to understand them in the different contexts. So in the different geographical contexts, we need to understand them, across different stakeholders. And we need to talk with these different stakeholders in these different geographical contexts in order to understand what they think might facilitate, what are some of the answers.
So as the Autism Alliance of Canada, we really want to get the members of our people across the country to share their opinions and experiences. When Miriam and I first got together to start thinking about this project, it was looking at how children or families who don't speak the majority language in their province or territory or region are able to access services. And what are the qualities? What are the barriers? What's the experience of these families? Is it different? This kind of work will actually help with our what we call data advocacy, so affecting policy. And right now, we know the federal government's establishing a national autism strategy, so really informing some of the work of autism policy across our country to make sure the families who really don't get into the services they need or aren't able to access the quality of services they need, really pushing in that direction.
Hopefully also this will be sort of a springboard for maybe a broader province by province and territory by territory study like this one, but also implementation study where we actually go and look to see when we implement these strategies, do they work? Your language is part of your culture, and we want our kiddos to have access to their minority language and their minority culture. We want them to be able to participate fully in their cultural community. We want them to be able to participate fully in conversations at home, because that's part of their cultural identity, and I think that's important. So I hope that this project, also helps not only access, but also this idea of minority language and culture is important for our kiddos who have neurodevelopmental disorders, not just for neurotypical population.